Happy Wellness Wednesday, shifting gears to something a little more aesthetic, and I want to talk about Botox, especially to Black women and Black people, because obviously we all know Black doesn't crack, but that doesn't mean that we can't get Botox or we don't need Botox or we can't benefit from Botox. So Botox is, first of all, Botox is a trademark. So kind of like how Kleenex is a trademark, Botox is a trademark. We talk about Botox just like generally, but there are different brands that offer the same neurotoxins similar to Botox. I offer two different brands. I have Xeomin and I also have Jeuveau. These are both neurotoxins. Each brand's a little bit different as to how like wide they spread. Some say they spread like dime size, some say nickel. But what Botox is it's a neurotoxin. So it literally is freezing your muscles. And so obviously, once you start to age, our skin starts to get wrinkles, and to remove the appearance of that or to reduce the appearance, because you can't always get rid of all of it, patients will come in and get Botox or neurotoxin. Now, why would you get these before you have wrinkles? Because first of all, I do have a little bit of wrinkles, let me just say, but I also have gotten neurotoxin treatment, and that's because when you start using it early on, it can just delay and prevent the creasing of your skin, because after so long that you have wrinkles, even when you do have a neurotoxin treatment, you can still have like those lines that stay there. We measure how like deep and like the mobility of those wrinkles and fine lines in people's faces when we are doing our assessment. And so you can do preventative Botox or neurotoxin before you start to age, or you can get it later down the road. Neurotoxins generally last for 3 to 4 months. The more you do it, the more you're going to build up a tolerance to it. So you're not going to have to do it as frequently. You might be able to get closer to that 4-month mark. However, if you are like extremely active, have a very high metabolism, work out a lot, sit in saunas a lot, things like that, that also can burn off that neurotoxin a little bit faster. There are lots of places you can get neurotoxin, and there's lots of reasons to use neurotoxins or Botox that are not aesthetic. So you might hear people using Botox for migraines, for excessive sweating, even carpal tunnel, and there's lots of different reasons why that, but I'm just talking about the facial appearance. The most common places you're going to see patients get neurotoxin injected is forehead lines, frown lines, or the 11s as we call it, the bunny lines. So like if you scrunch up your nose right here, crow's feet, when you smile and you get those lines there. You might see people get a lip fillip. If they have a little bit of a thinner lip, they might do just some injections here, and I can kind of like relax this muscle and flip your lip up a little bit to give a fuller presentation. You can even see people get it in the chin if you okay, if you could get like that, those like dimpling in your chins, you might see people get that there as well. Those are going to be the most common places. Now, I get patients sometimes that ask me like about smile lines here. That's going to be more of a filler situation. There are indications for filler, but the other areas I mentioned are indicated for neurotoxin. Neurotoxin here is $11 per unit, and the amount of units you need just depends on how severe your lines are, how much space it is. Some people have smaller forehead, some people have a larger forehead, how strong those muscles are. Some people just need more. It's just going to kind of give it a range. On my website, I might even drop the picture in here. I have like kind of a guide of like what the average amount of units per area is. So for example, your forehead generally 10 to 20 units, so that's probably going to run you about $110 to $220 for that. Generally, the brands that we're using for the neurotoxin offer specials, so depending on the time of the year or how often you've been a patient, you can earn promotions and discounts, or we might just have a special running at the time. And you can even combine neurotoxin with other treatments. You can get a chemical pill and your neurotoxin at the same time, and sometimes that really actually impacts the efficacy of the neurotoxin and the chemical pill. I always like to caution people, there are very rare cases, but it can occur where some people do develop a resistance to it, and it just stops working over time. That's kind of unfortunate. There is some research behind that, but it's rare. It's not as common, but it can happen. So I might do another video just kind of talking a little bit more about it and kind of showing like where those injection sites are and how we go about that. But this is my Wellness Wednesday video for the week, and I hope you guys have a wonderful rest of your week.